We're here in San Diego at the American Society of Hematology Conference 2016, and joining me here this afternoon is Dr. Pardee from the Comprehensive Cancer Center of Wake Forest Baptist Medical Center. Doctor, it's so good to see you.
Thank you so much for having me.
So a lot of exciting news going on in cancer care. We're hearing immunotherapy, we're hearing combination therapies. And you're presenting a poster, I think, tomorrow. Can you give us a little preview of what you're going to present and some of the exciting data that you're finding?
Sure, my pleasure. So tomorrow's poster is basically reporting on the experiences that we've had with a really novel new therapeutic that attacks cancer cells in a really fundamentally different way. It's different from tyrosine kinase inhibitors, it's different from immunotherapy, and it really at the core of it, it attacks the differences between normal cells and cancer cells in how they use energy and nutrients. And so normal cells are really interested in doing the best that they can with the nutrients that they have to be the most efficient at doing their jobs, whereas cancer cells are really most interested in taking all the nutrients they can get and making the next cancer cell.
Got it. So at the fundamentals here, normal cells use energy and use other things to live. And so tell me again, explain to our viewers how the bad cancer cells are being affected by the energy.
So the cancer cells really view energy metabolism in a fundamentally different way. Normal cells view it as a means to do their daily jobs, to make sure that the body overall is healthy, whereas tumor cells view energy as a means to make the next tumor cell. And as a result, the way they handle energy and nutrients is really fundamentally different, and that allows us to target uniquely the way that the cancer cells handle energy and metabolism.
So when we identify these cancer cells and the way they're utilizing energy, what kinds of things are you studying? How do we differentiate the use of energy in good cells versus cancer cells?
Sure, so there was a fundamental observation that was made in the early 19th century, if you can believe that, and it had to do with the way that cancer cells handled sugar. And what they would do is really grab up all the sugar they could, where normal cells will only take up essentially what they need. And this was called the Warburg effect, named after the German scientist who first found it. And so that was the first hint that we had that there was this real fundamental difference in how cancer cells handle energy and nutrients.
And when we've identified that, then what's the course of therapy that we're looking at? So that we look at the way that these cells use energy. The bad cancer cells are using energy to multiply and make more bad cancer cells. When we identify that, then what's the course of therapy that a patient can expect to see?
Sure. So what we've been working with is this novel therapeutic called CPI-613. And what it does is it attacks the mitochondria of tumor cells. And the mitochondria is sort of the powerhouse of the cell. It's sort of the central part of the cell that deals with energy generation and nutrient utilization. And CPI-613 shuts down critical pathways in the mitochondria, specifically in cancer mitochondria, since regular cells use mitochondria too. But what we found is that this drug is really specific for the tumor cell and shuts down its ability to utilize energy, which would be used to either make the next tumor cell, or if they were being exposed to other therapies like traditional chemotherapy, they could use that energy generation to repair the damage from chemotherapy and to keep on living.
Got it. So where are we? I mean, can patients, I talk to a lot of cancer patients. A lot of them are looking for new therapies, or a lot of them are, going through the journey. With the study that you have going on, when can we expect to see something? Are we talking early stage here, or is this, in the near future?
So the study I'm reporting on was a phase 1 study for acute myeloid leukemia patients who had relapsed or were refractory to traditional therapies. And we have now opened what we call a phase 2 study, which is where we think we've got the dose and schedule of this novel therapeutic pretty well worked out, and we're giving it in combination with traditional chemotherapeutics. That trial is open and ongoing. You can find it on clinicaltrials.gov if you search for CPI-613.
Okay.
And our hope is to then generate more data using a larger randomized phase 2 trial and really prove what this novel approach brings to chemotherapy for these patients.